My name is Dr. Damien Lafferty. I'm a surgical podiatrist with over 12 years of formal education and more than 30 years of clinical and surgical experience. Today, I want to present the first in a series of talks on ingrown toenails. I'll initially be speaking specifically about chronic and revisional ingrown toenails, the cases that haven't responded to routine treatment or previous surgery. Many patients who present with chronic ingrown toenails have been dealing with discomfort for long periods, sometimes months or even years. They may have already seen various practitioners, had previous procedures, or received multiple courses of antibiotics without long-term success. By this stage, the nail and surrounding tissue, often showing signs of ongoing inflammation, overgrowth of tissue, that's the hypergranulation tissue, or structural changes from earlier treatments. Previous experiences can sometimes contribute to fear or anxiety about further care. This may occur if past procedures were uncomfortable, incompletely anesthetized, or if the anesthetic wore off during treatment. These experiences highlight the importance of adequate pain management and clear communication before and after surgical intervention. In chronic or revisional cases, the treatment plan should aim to permanently correct the underlying cause or the problem rather than provide short-term relief. This requires an accurate diagnosis, precise removal of the ingrown toenail section, careful management of any scar tissue, and the use of appropriate anesthesia to ensure patient comfort. Depending on the severity of the case and the patient comfort needs, several anesthetic options should be considered. For most cases, a local anesthetic is sufficient as long as it's carried out efficiently. For patients with significant anxiety or previous trauma, nitrous oxide, commonly known as laughing gas, can be used to provide additional relaxation, which is provided by one of my colleagues. In rare or severe revisional cases, short-day surgery procedures under general anesthetic may be appropriate, particularly in patients with anxiety or phobias. The key objective is to ensure the procedure is both comfortable and effective. It's important to understand that antibiotics alone cannot cure an ingrown toenail. They may temporarily reduce the redness or swelling from the secondary infection, but they do not address the actual underlying root cause, which is the nail pressing into the surrounding skin. While antibiotics may be prescribed when there is evidence of infection, the definitive management involves correcting the nail's growth pattern to prevent recurrence. In surgical management of chronic or revisional cases, the focus is on achieving long-term stability and preventing regrowth. This involves addressing the nail root matrix, correcting soft tissue changes, and restoring normal anatomy of the toe. A successful procedure should aim to prevent recurrence, maintain function, and preserve cosmetic appearance. This procedure should be the last operation. Most patients experience minimal post-op discomfort and can return to normal activities relatively quickly with appropriate care and follow-up. If you or someone you know has a chronic or recurrent ingrown toenail, it's important to seek professional assessment. A properly planned and executed procedure can provide lasting relief and prevent further complications such as infection, scarring, or persistent pain. Again, the aim should be to the last op once and never again. Thanks for your listening.